According to Miriam Berger's 2019 article, all it takes for Brits to love their socialized medicine is to learn the staggering cost of healthcare in the United States. The cost of having a baby here is somewhere between $10,000 to $30,000. And the sad thing is, that isn't that shocking. Because you see, in America, unlike other countries, we do not have universal health care. And that is a problem. So for this speech, I'm going to discuss the issues of why America doesn't have the issues of America not having universal health care and why universal health care would be a good thing. I'm going to start with human rights, access to medical services, and the cost. So to start off, the American healthcare system does not protect human rights. According to Sarah S. Willen's 2019 article, Evoking Health and Human Rights in the United States, the US has not ratified several international treaties that would have guaranteed health as a basic human right. And several presidents have pushed against such treaties and have even pushed in the opposite direction. In fact, according to Robin Osborne's 2016 article, a new survey of 11 countries, US adults still struggle with access and affordability of health. The United States is one of the highest countries with barriers to healthcare, up to 35%. And in fact, according to Willen's article, most people would go for a market-based solution to healthcare instead of one created by the government. And that's only the beginning. That doesn't even talk about how limiting the American healthcare system is for access to services. According to the Osborne article, 33% of Americans go without recommended healthcare, and 14% do not get support for the chronically ill. Gill opposing viewpoints online collection document states that 27 million people do not have health insurance and struggle to get health care. And according to a Peter G. Peterson Foundation article, How Does the U.S. Healthcare System Compared to Other Countries? The U.S. has shorter hospital stays, is one of the worst places for managing diabetes, and has the highest infant mortality rates. And even with all that, that goes nowhere without the cost. According to the Peterson Foundation article, it costs $11,100 per person for healthcare, and the annual GDP says that 17.7% of the GDP is for healthcare. And if you're a member of the low income, you're going to suffer more chronic illnesses because you cannot afford it. And as a result, more people are worried about housing than they are about their own health. And according to the Osborne article, as stated earlier, 33% of Americans are without health care. And according to the Gale article, it costs $7,000 for a broken leg. And almost 40,000 people die per year because they do not have health insurance. In this country, our ability to be happy, healthy, and safe is not a guarantee. Our people, our government cares more about money than keeping us safe. But that doesn't have to be the case. For in Europe, they have universal health care. And this is how they differ compared to us. According to the European Agency for Fundamental Rights, the European Union has Article 35. Now, this article basically states that everyone is guaranteed health care. It is considered a fundamental right. And according to Towards Better Healthcare, the universal access to healthcare in the European Union, access to healthcare is a key element of protecting social policies and striving to have health systems in place that deliver services that match the population's needs. Europe places their people incredibly high on lists of things that are incredibly important, such as their health. And according to the healthcare expenditure statistics, the highest GDP there is 11.5%. That's a 6.2% difference compared to the 17.7% the United States spends. And according to the Peterson article, European healthcare is just as good, if not better, than American healthcare, and it costs less. So why do we need universal healthcare? Because here in America, our system is broken. The 2020 pandemic terrified everyone. It caused mass panic. There was shortage of hospitals, doctors, and nurses. It showed us that our healthcare system does not care for our human rights, giving us access to services, or how much it costs. But if we had a universal healthcare system, this would all be a thing of the past. We would have better healthcare at half the cost, and everyone would be guaranteed to it. Now that's a future I believe we should be striving for.